Welcome. I'm just trying to run through a little bit again once about the set 2, the answers and explanations. As you all know, the first 5 questions are on antenatal care, 4 questions on antenatal care, and 1 on postpartum problem. They're very straightforward, asking for the timing of when the quickening occurs in pregnancy in a 16-weeker. And the answer, of course, is 16 to 16 weeks, which is usually in the multiparous women, it's between 16 and 18 weeks. All right, 14 to 16 weeks, sorry. And like that, the rest of the answers are very straightforward. For example, the so-called third day, fourth day blues occurs in patients immediately about 3 to 4 days postpartum. That also is explained. So the explanations are very straightforward, and I suggest you read through the guidelines that are given. Okay, and that is up to the 5. And 6 onwards, as I told you, again it's on antenatal screening. The answers are again straightforward. Okay, don't look up the options first. Please read the question and then think what is possible and then go and look at the answers. Okay, and that's what you exactly should do. And 11 to 12 is 2 questions mainly on the obstetric analgesia and anesthesia. And it is relating to the thromboprophylaxis and when should it be stopped in relation to anesthesia or operation itself. And the next 2 questions are on hypertensive disorders in pregnancy and especially eclampsia. And the next 2 questions are again hypertensive disorders. So you must read about hypertensive disorders in pregnancy, and the guidelines must be read very well indeed. What I am planning to do is from set 3 onwards, immediately after the exam is done by all of you, I will send appropriate a link sheet which will give you links on videos and also will indicate to you where guidelines can be found. I suggest you watch the videos when you are free, and also at least I'm only going to give you one video which is very suitable. And YouTubers, don't go and waste your time on YouTube. I'll find the exact one that is most suitable for the answers for the questions. So it is like, so you read that, you go through the video, you read the guidelines, and then go and correct your questions. So you probably will then realize that you have started correcting the answers correctly, and also you beginning to pick up knowledge the way that we want you to. The next 2 questions are on pregnancy and diabetes mellitus, and then there is some questions on physiology of pregnancy. That's the last question, which is question number 20. This is the EMQs, and I will also show you, go through quickly the SBAs in the for the part 2. Here it is, and Okay, here is your set 2 of SBAs. Questions are of on inheritance of diseases and genetic inheritance. So question 2 is on venous thromboembolism. And this, as I told you in the initial advice before the exam, that you must answer them correctly. And then hemoglobinopathies, okay, and the questions are based on hemoglobinopathies, which is absolutely necessary. You must read about sickle cell. It's not uncommon in the UK as well as in the Gulf. Other thing about fetal disease, especially this question is based on fetal hydropsy, which you must be very familiar with. Some of the explanation given are very, very adequate. And early pregnancy loss is a very important subject, because there are early pregnancy care divisions in all obstetric departments in the country, in the UK. So you must know about how to manage early pregnancy loss and early pregnancy problems. Then there is a question on eclampsia, which is hypertensive disorder, gynae infection, and the explanations are very good. And pregnancy and diabetes mellitus. So you already must have read it with the EMQ. So the topics are the ones that you need to look at. And pregnancy proteinuria is related to one of the symptoms, which is related to hypertensive disorders. And vulval dystrophy is a subject you must know. It can come for any part of your exam, and this is a fairly reasonable discussion there. And it is about lichen sclerosis, but you must read about vulval dystrophy. Pregnancy nutrition has become a very important global problem, and you must know about it, and that is being asked in the next question. And early pregnancy loss again, abnormal uterine bleeding, which is a gynae question, and then iridiform mole, and pregnancy malpresentation. There is one question on breech, and the next one is on neonatal infections, which is very important. So neonatal problems and complications, you must have a look at it. And the next question back to pregnancy infections and hypertensive disorders of pregnancy, which have already been asked earlier. And multiple gestations is, you must read about it. It's about twins and multiple pregnancies. So I think the areas covered are very straightforward and they're reasonably important. So you have about 5 or 6 subjects that have been asked in this full exam. So you can read them and update themselves. Again, as I told you, from set 3, I will give you videos. So I suggest you watch one video on one subject. Give about half an hour to watch each. So you have about, in the 5 days or 6 days of your study for the week, you have half an hour into 2 every day, or even you can watch one hour of video and then go and read up about it for another half an hour or so. So I hope your planning is beginning to start taking some sort of shape in your revision and in your studies. All the best to you. Assalamu alaikum.